This video will show you how to inject yourself with your Gonal F pre-filled pen. It contains instructions for use. It should be viewed after reading the leaflet that comes in the Gonal F pen packaging. Before using your pen for the first time, please watch the video all the way through. Step 1. Getting ready. Wash your hands. Make sure you have all the necessary items before you begin. This should include the Gonal F pre-filled pen, one needle, and alcohol swabs. Before you begin, take a moment to examine the pen and the medication. Check that the pen has not expired. The expiry date can be found on the label of your pen and on the box it came in. You should also ensure that the medication in the pen is clear. If it is not clear, or if the medication contains particles, do not use it. Instead, call your doctor, nurse, or pharmacist. Attaching the needle. Remove the pen cap. Remove the peel-off seal from the outer needle cap. Attach the needle by pressing the threaded tip of the pen into the outer needle cap. Screw it until it is firmly locked in place. Remove the outer needle cap, but save it for removing the needle after your injection. Look carefully at the drug reservoir. If you don't notice any large air bubbles, the pre-filled pen is ready for use and you can move straight to Step 2, setting the dose. However, if you do notice a large air bubble, watch the section at the end of the video called Removing Air Bubbles before moving to Step 2. Step 2. Setting the dose. Turn the dose setting knob until your prescribed dose appears in the dose window on the side of the pen. Please do not push or pull the dose setting knob while you turn it. Always check that the number showing in the dose window corresponds with the correct dose that your healthcare professional has prescribed for you. If the dose you dialed is too high or too low, turn the dose setting knob again in any direction until the number showing in the dose window is the dose that you were prescribed. Now, remove the inner cap of the needle. Step 3. Injecting. Your healthcare professional will have discussed suitable injection sites with you. To minimise discomfort, it is best to select a different injection site each day. Clean the recommended injection site with an alcohol swab, or as shown by your healthcare professional, and let it air dry. Hold the pen and insert the needle into the skin. Push the dose setting knob as far as it will go. With your finger or thumb still pressing the dose setting knob, keep the needle in the skin for 10 seconds. After 10 seconds, still keeping the dose setting knob pressed down, take the needle out of the skin. Make sure you have given yourself a complete injection. Check that the dose window shows 0. This will confirm that the dose has been delivered completely. Caution: if the dose display shows a number higher than 0, this indicates that the pre-filled pen is empty and the complete dose has not been given. If this happens, the number in the dose display will indicate the missing amount of Gonal F solution to complete your dose. This is the dose you need to inject using a new pre-filled pen. In the case shown here, the additional amount required from a new pen is 37.5 units. To complete your dose, follow the steps described previously from getting ready through to setting the dose. Set the dose on the new pen to the exact number displayed on the dose window of the empty pen that you just used and inject this amount. After your injection. Remember to take the needle off the pen after each injection. Hold the pre-filled pen firmly and carefully put the outer needle cap back onto the needle. Please be careful not to prick yourself with the needle. Once you have done this, grip the outer needle cap and unscrew the needle. Do this by turning the needle anti-clockwise. Dispose of the used needles safely. Ask your healthcare professional how to dispose of needles that are no longer required. Now, put the pen cap back onto the pen. Please remember never to reuse any used needles. Also, never share needles. Caution: always remove the needle from the pre-filled pen before putting the pen cap back on. The pen cap cannot fit over the pre-filled pen with a needle still attached. Never store the pen with the needle still attached. Store the pen as instructed by your doctor or nurse and read the How to Store Gonal F section of the leaflet in the Gonal F package. Thank you for watching this video. If you have any other questions about how to use your Gonal F pre-filled pen, please ask your doctor or nurse for advice or call our support line for assistance. The support line contact details can be found in the case that your DVD came in. Removing air bubbles. Follow these steps whenever you see a large air bubble inside the drug reservoir. An air bubble is large if it fully fills the top of the reservoir holder when holding the pre-filled pen with the needle pointing upwards. To remove a large air bubble, set the dose setting knob to 25 units. Remove the inner needle cap. Hold the pen with the needle pointing upwards. Gently tap on the drug reservoir to allow any air bubbles to rise to the top. It is normal for a few small air bubbles to remain. Keeping the needle pointing upwards, push the dose setting knob in completely. A small drop of liquid should appear at the needle tip. This means that the large bubbles have been removed and the pen is ready to use. This process can be repeated one more time if necessary. Please note, the process should not be carried out more than twice. 2 attempts at removing air bubbles are the absolute maximum. In the unlikely event that you do not see liquid appearing at the tip of the needle after a second attempt, remove the needle, dispose of it as described in the previous section, and replace the pen cap. Then contact your healthcare professional to arrange for a replacement pen. Thank you for watching this video. If you have any other questions about how to use your Gonal F pre-filled pen, please ask your doctor or nurse for advice or call our support line for assistance. The support line contact details can be found in the case that your DVD came in.